we are going to move to House Bill 5072. 5072 is from Representative McNamara regarding insurance. This is the accessible residence modifications, which allows health insurance plans to provide coverage for accessible residence modifications determined to be medically necessary. We have one witness who would like to testify verbally. We do have two witnesses who sent in written testimony, one for and one against. And actually, Bob Cooper, who is for the bill, is the person who we're going to hear from. Do we have Robert available? Hello, Mr. Cooper. Mr. Cooper?
Yes, Mr. Chairman.
Yes, sir. This is Representative Casey, Chairman of the House Health and Human Services Committee. I have you here on House Bill 5072 by Representative McNamara regarding the health insurance plans to provide coverage for accessible residence modifications if they are determined to be medically necessary. If you could keep your testimony brief, I would like to, you did testify on this last week, I believe, correct?
No, I was one of those who got caught in
okay.
technical whatever.
Okay, well, let me tell you then, you go ahead and just take a couple of minutes, if you would, and give us your testimony. You're the only person testifying virtually, and there is only one other person who sent in testimony against that on the written testimony side. So go right ahead and speak, sir.
Yeah. Hello, members of Health and Human Services Committee. I'm Bob Cooper with the Governance Commission on Disabilities. Back in 2018, Chairman McNamara and Chairman Felag created a home modification pilot project to assist families of modest means of modifying their homes. One of the things that we did during this pilot, in fact, the pilot's still going on, is we asked the healthcare provider what the outcome would have been without the modifications. During the pilot project, we covered 351 homes. Believe it or not, 163 people in those homes would have had a much greater incidence and likelihood of fall. And of those, at least 93 would have ended up in a long-term care residential facility, whether a nursing home or some other facility. Similarly, we had about 68 people who the doctor said would definitely have fallen and ended up in long-term care. We did some additional studies on other things like ramps, what kind of changes would have happened without person. The pilot project is limited to 120% of the U.S. Department of Housing and Urban Development medium income criteria. People who are eligible for Medicaid, as an insurance provider would pay for some accessibility provisions just to keep people out of nursing homes and such. For the people in the who got the home modifications, if they hadn't gotten them, the state's Medicaid program would have ended up having to shell out almost $7 million annually in covered services. So it's our belief that people who income is greater than that threshold would actually reduce the cost from insurance carriers because we would be reducing the likelihood of falls and other health conditions because they'd be able to remain in their own home, and they would be able to get around the home in a safe manner. Some of those modifications we've done are walk-in showers, adding grab bars and other modifications in the bathroom, ramps, lifts, and other things that keep people in the community. That frequently ends up using those folks using a lower amount of health care services than if they had moved into a nursing home or other assisted living services. Happy to answer any questions.
Thank you for your testimony, Mr. Cooper. I appreciate it. Are there any questions from the committee regarding House Bill 5072? Okay, Mr. Cooper, thank you for your time. We appreciate your testimony, and we're going to close the hearing on House Bill 5072.
You're welcome.
Thank you.